Good morning, everyone. Thank you for joining us for today's presentation. Should be an exciting time to learn about the tiered waiver system, and I'm looking forward to it. I hope you are. A couple of things before we get started. If you will make sure that your mic is muted for this presentation. I can catch them sometimes, but we get a lot of extraneous noise and it's difficult to hear, so try to keep your mic muted. Also, I will be asking you at the end to do an evaluation. It's just very brief, like the ones that we always do at the end of our trainings. So I'll drop that in the chat box toward the end of the presentation. So we have with us today Dr. Amy Greer from the Office for Citizens with Developmental Disabilities, and she and a couple of colleagues are going to talk to us about the tiered waiver process. And then I believe she's going to take questions at the end. Thank you so much, Dr. Greer, for being here. We look forward to it.
Thanks so much, Sharon. We're excited to be here. In addition to myself, we have on the screen Dr. Brandy Kelly. She is the OCDD Clinical Director. While the information we're talking about today is not clinical in nature, Dr. Kelly, in addition to being our clinical director, has a very long history and expertise, and so she is our point for the planning process, resource allocation, and a lot of the guidance and design that went into where we are today with our waiver system. So she's not connected to the waiver area, but we do use her expertise and guidance. So we thought it was important to have her here too. In addition to Dr. Kelly, and I apologize, but we're somewhat kicking it old school with this presentation while Brandy and I are on screen on video. Mr. Paul Rohr, who's the OCDD waiver director, we were having some technical difficulties. So he is actually not on the screen or at this point on the line. I have him on the cell phone and he's going to participate that way. So I apologize, but we're going to make it work. Mr. Rohr has a very, very long history in the DD system. As I said, he's our waiver director. And again, the three of us wanted to be here. We've heard in meetings that we've all sort of been associated with lots of questions from folks about the SUN and about the tiered waiver. And so we are recognizing that there's a need for us to do a better job with getting information out to folks so that there isn't this mystery and people know where to go when they have questions about waiver. Or when they have questions about what other types of services might be useful for somebody with a developmental disability. You know, where can they go to explore an array of services? So I'm going to start us off, and then I'll turn it over to Dr. Kelly. She's going to give sort of the larger overview of the different types of services that somebody with a disability might need to access. We're also looking forward to hearing from you all and taking some questions at the end. As I said, we're interested in getting better with getting the information out to folks. So your feedback today is going to be an important part in helping us shape how we give this information moving forward. All right, so as I noted, so Paul hung up. I'm assuming he's in on phone now. Okay, so let's start about just services in general. What types of services might somebody with a disability be interested or need to help with their day-to-day life? So where does someone go and how does it all work? All right, Dr. Kelly, I'll turn it over to you.
Good morning. So I wanted to start off by talking a little bit about the difference between the waiver and the Medicaid state plan services. I'm not going to go into a lot of crazy details that will get confusing, but just wanting folks to understand that everything that someone needs to meet their supports related to their disability are not in the OCDD system. And so that's important because it means that you don't have to wait for something or wait to get a son and get a priority for some of those services. It also means that if you aren't going to one of the other systems, then you may not be accessing what you're trying to get. So we've had some confusion over that. So the waivers that we operate, if you look at how waiver services were originated across the country, they are really designed to supplement other existing state plan services. So the state plan services have to be accessed prior to waiver services. So that's why you will see that sometimes in this Children's Choice, for example, we won't have services that we have in some of our other waivers because kids have to access all medically necessary services through the Medicaid state plan. And that is a mandate by the federal government. EPSDT stands for Early Periodic Screening, Diagnosis, and Treatment. So what it means is that there is an expectation that every state, not just our state, has available with no wait and no limit, all medically necessary services for youth through the Medicaid state plan. So to access that, you're going to go through either a health plan, and we'll talk about that in a minute, if you have full managed care, or you're going to access it through Medicaid if you have fee-for-service for your non-behavioral health services. So none of those would require you to come to the waiver services. So our waiver services are really things that you cannot get in the state plan and still need in order to be able to stay home if you have a disability, go to school, go to work, get out and about in your neighborhood and your community. If an individual does not qualify for Medicaid through the typical Medicaid process, perhaps it's a kid who has the family income doesn't qualify, the new TEFRA option is available. And all individuals who meet the ICF level of care access and go through the Medicaid state plan eligibility process would then be able to get their Medicaid services through the state plan without having to get one of our waivers first. It used to be that if your family income kept you out of Medicaid, then you had to get the waiver first. Then the waiver, that's why they call it a waiver, would waive the family income. And then the individual could access not only the services in the waiver, but also the services through the regular Medicaid state plan. So this is a new option that went through during all these crazy years that we've been dealing with COVID. So some people are aware of it, some people may not, but there is a way to access those services without having to get an OCDD waiver first. So again, that's a quick just understanding of there are services that are available, things like going to your doctor, going to see a PT and OT, a speech therapist, other medical specialists. There are some personal care attendant services that are available for youth. There are also some personal care services that are available under the long-term personal care service for adults in the waiver. The applied behavior analysis is in the state plan. It is not in the OCDD waiver. I say that because sometimes there's a lot of confusion about that because it is most often accessed for folks who have autism or related disabilities. And all the behavioral health services that someone should be able to access are all in the state plan. So your waiver services are really more about other support you need at home. It's about support to get a job and work. There may be some other technology supports that are in there, like with the personal emergency response system, where someone who can't perhaps get emergency services through another mechanism is able to do it in that way. There are some environmental modifications and some equipment that are available in most of the waivers. There are some specialty therapy services that are in our Children's Choice waiver, which folks are going to talk about. But so those are the things that are in the waiver, and all the other services are in the state plan. I mentioned personal care because we have to look at whether or not someone is able to access services in the state plan first, and would those meet someone's needs. But there are in-home supports, obviously, in the waiver. And our service allows for more flexibility to access services, not just for medically necessary things or basic activities of daily living. So sometimes people will need what we have in the waiver, but that's an example of a service that is There's some commonalities in both systems, but there's a little bit of a difference to get the waiver. There's some home health services, there's some nursing in-home services. So that's when people are asking you about the services that you receive when they're doing your son's school screening or in planning, it's because we have a federal obligation to make sure that people are able to access all those services in the state plan, and that our waiver services are accessed when those are not able to meet people's needs. It's also important to understand that from a budget perspective, state plan services are obligation services on the part of the state. If we have a Medicaid program, we must provide those services. So when people are looking at things that we may need to cut or limit in some way, when there's a budgetary challenge, which many of us have all lived through, I'm sure some of you remember those times where cuts were discussed, those services cannot be limited or cut. The waiver is not an obligation service for the state. It probably doesn't feel to most of us like it's optional, but it is in the optional services menu for the federal government Center for Medicaid and Medicare Services. And so that means that if the waiver services get really, really costly, or if we have budget issues, then those services get looked at. So we want to certainly be sure that anything that's available in the state plan, that people are accessing it that way, because even from a budget perspective, those dollars then show up in the right place in the budget, and they don't then get put at risk. And then it allows us to really make sure we're using our waiver in the best way to serve the most people, and to make sure that we can talk about how these services really cost us not that much money to serve people and help them stay home, and they are supplementing these other services the state is obligated to pay for. So we wanted to kind of share that with you guys so you have a little bit of a better understanding of that, and why you may get asked some questions, especially on that sunscreen, about services you might be accessing or not yet accessing that are in the Medicaid state plan. Dr. Greer, you can go to the next one. So I know that it can be confusing and complicated. I'm going to elaborate a little bit more on some other systems. So we just talked about Medicaid services. The Healthy Louisiana managed care plans and the coordinated system of care are all components that are funded by Medicaid, but they branch off from the traditional Medicaid fee-for-service. So individuals who have DD waivers and youth that are on our registry can opt out of managed care for part of their Medicaid services. But there are services on the behavioral health side that are only available through managed care. So what that means is that everyone who has a disability condition, has an OCDD statement of approval, and is in the Medicaid enrollment system has a health plan, at least for their behavioral health services. So if you're not accessing those services, a lot of times folks are not interacting with their health plan. So they've opted out of Medicaid for their regular health services and things like personal care, all those non-behavioral health services. And so in their mind, they may think, well, I'm not in managed care. So it's important to remember that everyone has a managed care plan for behavioral health services. And if you didn't choose your plan, one was chosen for you. So you may wish to look into that to be sure that you are really connected to a plan you want to be connected to, in case you or your family member, if you are a family member, need to access those services. So that's the Healthy Louisiana plans. So minimally, people are getting all their behavioral health services through a health plan. And then they may be in what they call full managed care. So you may get all your Medicaid services from that Healthy Louisiana plan. Or if you opted out, you're then intersecting with your Healthy Louisiana plan if you need access to behavioral health services, and you are interfacing with the regular Medicaid system for your other services. One thing that it is important to know is ABA is only in managed care. So it is grouped together with those behavioral health services. So even if you are thinking you don't access other traditional behavioral health services, but you do have behavioral health services, but you do have ABA, then that is also being accessed through your Healthy Louisiana plan. Dental services are also only accessed through managed care. I did not put that on here. There's some newer stuff that we are doing with dental, so I'm not the guru there. But there are 2 dental providers that interface with Medicaid related to dental services. The coordinated system of care, not everyone will access, but youth who cross multiple systems. So our DD system and the behavioral health system, for example, we do have some youth who also interact with DCFS or the juvenile justice system, and those youth would also qualify. But individuals who have are accessing services across systems and have some complex needs, they may qualify for the coordinated system of care. And that is one single managed care plan. They work with your other managed care plan to make sure your needs are met if you qualify. And there are some additional specialized services that can be accessed to support an individual and their family through the coordinated system of care. And there is some wraparound facilitation services that are also available. It used to be that if you had the OCDD waiver, you couldn't access all of those services because some of their services are also provided by the same kind of waiver we have, and you can't be enrolled into at the same time. The state has made some changes so that the important extra components of coordination and wraparound that are available in CSOC can be layered on top of our waiver, so youth can get that coordinated system of care. And then remember that sometimes there are other school or vocational systems depending on someone's age, right? So you may be getting services from school, you may be getting services from Louisiana rehabilitation system. And then that's in addition to DD service systems, which would include early steps, our OCDD waiver services, and the family flexible funds and individual family supports that are available through your local governing entity. And then, as I mentioned earlier, some folks are going to interface with other systems like DCFS and the Office of Juvenile Justice. So it can certainly get confusing. It's important to know all of these systems and understand what you access where, so that you also can be sure that you're going to the right place. And then quickly, Dr. Greer, if you put up the next slide. Instead of being confused, it is also important to understand that most of these systems also have coordinators who can help you. So in the DD system, if you have a waiver, you have a support coordinator. If you are receiving services from the local governing entity, they will have someone who is helping you coordinate as well. And if you are in early steps, there will be an early steps team and a team lead, as well as family support organizations that can help you. For your Healthy Louisiana plan, there is a care coordinator. If you are enrolled in the coordinated system of care, you will have a wraparound facilitator. If you do get some services from Medicaid, you can. If you are a youth or you have a youth receiving services, get an EPSDT case manager. In school, there are IEP facilitators that you can request. They're not going to necessarily be given to you automatically. And if you are getting services through Louisiana Rehab Services, there are vocational rehabilitation counselors. So all of those folks can talk to one another and can help you so that you're not navigating the systems separately. And then again, if you're in another system, you can always ask for help with any of those things. So this was a really, really quick, brief intro. There may be more questions, and we can certainly share info in some other form with folks, but we wanted to at least introduce these concepts and make sure folks understood all the systems and understood that there is help that should be available to help you navigate any system that you need to access. So, Dr.
Thanks, Dr. Kelly. And as we shift to the next slide, let me also say, Dr. Kelly used the word local governing entity. We get feedback from folks that we use a lot of long words that other folks might not be using when they're thinking. So local governing entities, you've heard of it as LGEs. Perhaps you've also heard of them as human services districts and authorities. That is the local DD office. And so for the purposes of this, when we're saying LGE, we're talking about our local DD office. All right, so let's talk about why the state shifted to a tiered waiver. And I'll share some background information that'll kind of help walk us through where we got to, today. So between the years of 2012 and 2015, we took a look at our service system. We had, in the years prior, had done a lot of work in terms of resource allocation with the NOW. And we had realized some, not just cost savings there, which as Dr. Kelly mentioned in the beginning, that's important if you want to look at sustainability of the waiver. So we realized some efficiencies with that. There was also just sort of the service landscape was changing. And so really taking a look at where were we in terms of offering opportunities to live and be connected in one's community. And that was growing. Managed care for behavioral health, as Dr. Kelly noted in the prior slides, that occurred over this period of time. So there were different service options, even in different systems for folks. And so those pieces were working. We also looked at what was not working and perhaps what we needed to change, or at least some gaps that we needed to plug. And despite some of the cost savings and the better ability to connect folks with the services that they need, we still had a lengthy waiting list. Coupled with, there was only a 50% acceptance rate when we offered a NOW. So that was a little concerning too, right? You've got a long list of people waiting for the NOW, but only a 50% acceptance rate. We have 4 waivers, and that was a little difficult to navigate. And so having different service options, while on the one hand, that's helpful and needed, if these options are difficult to navigate, then you've got people waiting around and are not getting connected to the needed services in a timely manner. And then services across the waiver weren't consistent. So in addition to looking at the system, we also looked very closely at the RFSR, which is our Request for Services Registry. Historically, and so certainly during the years of 2012 to 2015, that was our wait list. We don't have that anymore, but at that time it was the wait list. It was people waiting for a NOW. So as I noted, that list was growing. Again, the budgetary constraints, that is something that we grapple with, and we need to do our best to make sure that we have a service system that is sustainable for the future. And so that was a concern. We also didn't have a lot of information about folks who were on the registry and who were waiting for the NOW. So, were they waiting for the NOW and they needed the NOW? Were they already receiving services in another waiver, and that perhaps was meeting someone's needs? Were there services outside of the DD system that someone needed that they were hanging around on the registry thinking that that was going to get them connected to services outside the system? So there was a lot of different dynamics and factors at play. And looking at and evaluating the registry allowed us to sort of uncover these pieces so that it could shape where we got to today in terms of helping folks get connected, at least within waiver, to the waiver and the services that are most needed. All right, let's talk about the SUN. As I noted in the beginning, we get, every time I'm in a meeting, it feels like we get a lot of questions about the SUN. So I'm hoping that this information is going to perhaps clear up some misperceptions or some understandable confusion about the SUN process. Anything that I don't hit in these next several slides, we can talk about at the end of this presentation. All right, so let's talk about the development of the SUN process as we use it today. Like much of what we do in OCDD, we build things with stakeholder input from individuals, family members, advocates. We have really good resources to help us craft and shape our service system. And so this group agreed to move the registry from a first come, first serve to a prioritization. And again, that's the emphasis on, I mean, it's one thing to get in a line, but when that line is very, very lengthy, it doesn't help the folks that need it the most urgently get a service. And so prioritization, there was shared recognition that prioritization is really the direction we needed to head in. And we also looked at the current tools and the needs-based assessment as it pertains to what we were doing up until then in terms of the emergency waiver, how we were using that information to determine folks who would receive those limited emergency waiver options. We looked at what other states are doing to try to learn what was working for them in terms of their screening for folks with urgent needs and prioritization of that. And maybe what also was not working, that so we wouldn't have to repeat mistakes that were already known. And then we took an existing tool and we modified it to meet the needs of folks in Louisiana. All right. So when you hear the word SUN, a lot of folks attach the term assessment behind it. The SUN is not an assessment. It is a tool. It's a screening. It's the screening for urgency of need. And that's an important distinction. As a clinician, when myself or Dr. Kelly use the word assessment, that implies a more comprehensive snapshot of someone's abilities, skills, talents. A screen is really designed to be a tool to look at in a very quick, more limited snapshot, what are the most pressing needs. So that is an important distinction about the SUN. So it is a tool, and we've crafted a process that helps us look at what the person has by way of current supports. What are they using? What are the unmet needs? And again, Dr. Kelly mentioned about a lot of the questions sort of probing not just what the needs are as it pertains to someone's developmental disability, but what are the other health and wellness needs? Really trying to take a holistic look at the person. And so what are the urgency of needs that someone has? That's an additional important factor that the SUN allows us to look at. In addition to identifying somebody's unmet and met needs and how urgent it is or are, it also helps us moving forward in terms of prioritizing folks for the registry. So you use someone's urgency of need along with their protected date, right? The day that someone was placed on the registry to prioritize how folks receive services. It allows us to be responsive, which, as I noted, that's critical when you're trying to get folks connected to services, especially when they urgently need or emergently need certain services and supports. At any point in time, if someone's needs change, we can do a rescreening. So it's not as if, you know, what is discovered or uncovered at that initial SUN point in time remains unchanged. As people, we change, we evolve, our needs change over time. So we are positioned, and that process is positioned to respond if somebody's needs become more urgent or their needs change. And so all folks stay on the registry with a protected date. All right, so now we're going to talk about the steps to get a screening. I'm going to turn this over to Paul. Paul, are you able to unmute, or do you need me to do that? Let's hear him.
I have two people on phones. Is he a 225 exchange?
He will be a 225 exchange. I'm trying to ask to unmute, but Sharon, it doesn't seem to be letting me. Unless I've got the wrong number. All right. So as not to lose time, I'm going to keep talking.
Hey, Amy, can you hear me now?
I can hear you now, Paul. Go ahead.
Okay, I apologize. This is Paul Rohrer with State Office. And again, I'm following the slides on my computer. The purpose of the SUN, I'm sorry, steps to getting the screening. And again, I think Drs. Greer and Drs. Kelly talked about the importance of your local government entity. And we have 10 local government entities statewide, and that is your first source of contact. The only reason I bring that up is because we have had calls up here with real urgent cases or emergent cases, but when we check to see if the individual had gone through system entry or had a statement of approval, the local government entity did not know that who the individuals were. So again, the first point is that anyone wishing to come into the DD system gets with their local government entry system and get a statement of approval. The local government entity staff will complete the transmittal form and scan that over to Statistical Resources Incorporated, or SRI. They are our data contractor to put the individual for placement on the Request for Services registry. Once the data contract, or once the LG has got all the documentation is received, SRI places the person on the RFSR within 14 calendar days of receipt of all the information from the LGE. The individual or family will get a confirmation letter notifying the person's name and has been added to the registry, which would be mailed to them. That in turn triggers a process where the RFSR, Request for Screening Register, the monitor here will get notified and will assign a person to the OCDD screening staff for an initial screening within 5 calendar days of receiving the confirmation person is on the registry. Final point is the screening staff will contact the individual or the guardian to schedule the screening appointment. So again, I do want to emphasize the LGE, because again, that is your first point of contact in getting the individual into the developmental disability system and getting a statement of approval.
Thanks so much, Paul. All right, so I'm going to turn it back over to Dr. Kelly, and she's going to talk about, just sort of give us an overview of how the process works.
Yeah, so we're going to talk about the process of what it feels like when you actually get a screening. One of the things that was really important when we did the development is we had some individuals with disabilities and family members, as well as some advocacy group representatives who work with us to develop the SUN and its process. So what should happen when you get a SUN is that the person should at least begin by asking you some information about you, if you are a person with disabilities, or your family member, if a family member is the one who is providing the information, they will ask about your family member. So we want to know something about what matters to the individual and their family. What is important to you in life? What are your what's your vision for life in the future? What goals do you have? Because that's the best way for us to then move into some discussion about, well, what supports might you need to move forward in life, to meet those goals and to move towards that life vision, and what do you already have access to and what's missing. So there should be some questions that are asked related to the person's life vision. I lost the screen sharing isn't happening anymore, Dr. Greer. Oop. There we go. I probably could talk without it, but
No, and I apologize. I think that
Okay, so Paul, can you hear me still? Sharon, can you hear
Yes,
me?
I can hear
Okay.
you. Just you're off for a second, but I hear you now.
Okay, well, Dr. Greer's frozen, so for a half a minute, I didn't know if I was the one not connecting or if she was. All right, well, I'm gonna keep talking. Hopefully, she'll reconnect and get back, and get back on with us. So, so there should be some questions about what matters in life. What do you see life looking like? What are your goals at home, at school or work, in your local community? This isn't going to be full planning, but it is an introduction to the conversation. So there is some understanding of the things that are important. You're then going to get asked, as we've mentioned a couple of times, about existing supports. What is it that you have access to today that you are accessing? And what is it that you have access to today that you're not accessing? And that's important because the screener then can make some referrals if there are things that could be met within your school, within the regular Medicaid state plan. Perhaps in some instances, small needs can be met through the local office, et cetera. So they're going to ask you those questions, and that gets to all of the things that I shared in the first sets of slides, because sometimes it can feel like, you know, a lot of questions and a lot of different, a lot of time, so to speak, spent on that. But we do need to be sure that people are accessing the things that they can access, and that if they're not, that we help them get connected to those things, right? Once they've talked with you about what do you have today, and remember that what do you have today could be paid services. It could be services through other community organizations that any of us could access. It could be things that family members and friends are doing to help someone. And then we will ask about the sustainability of that. Like, can this keep happening in this way? And that's what leads into the next set of discussions, which is, what are your unmet needs today, or your anticipated unmet needs? And so what we're going to be looking at after we do that is then, what is the urgency of those needs? Do you have, is it a current need? Is it something that needs to be met imminently, like right now in this moment? Is it something that, well, it's okay right now, but there's some time in the future? And then they'll ask you some questions about where that time is in the future. It's important to remember that some of the unmet needs that people are going to ask you about may involve things we can meet in the waiver, and there also may be things that are not in the waiver. And again, that's important because when we were putting together the SUN and the process, we did a survey of a sample of people who were on the registry at that time. And there were people who were telling us they were waiting for things that actually they didn't have to wait for, and it wasn't in the waiver. So we want to ask questions because, again, that paired with what we get from that existing support section helps us to better link you to other systems and referrals if there is a need that you could have met someplace else. So just remember that just because you check that there are some unmet needs or anticipated unmet needs does not necessarily mean those needs can be met in the waiver. And what should happen at that point is you also should be referred to the appropriate places where you may get those needs met. Dr. Greer, you can go on to the next slide because it'll dive into a little bit more detail on the 3 points about the SUN tool itself. So again, we're going to ask about existing supports first. What is being accessed now? What informal supports are available and in place? And then, are there things that are available that are not being accessed, right? So is the person having trouble attending school all day, for example, but there's no supports in school? If that's the case, we're probably going to encourage you to contact your local school and really revisit your supports in school, your IEP, or you know, your 504 plan, whichever one you have, rather than thinking that perhaps we can meet that need in a waiver. You might have some needs with activities of daily living or need some in-home skilled nursing, but it's someone who is under the age of 22 and could access those via the regular state plan. And yet maybe someone's not aware of that, or they're having trouble. And then we want to connect them with people, the right systems to meet those needs. Once we do that, we're going to then look at some unmet needs. And these are areas where you might need help, right? So this is not a set of services. What we're going to be asking you here is the screener's going to want to know what kinds of things do you need help with, because then we can better direct you to where you might get those services, right? It is important to know that the screener's not judging or changing your responses here. This is your response, right? We then are going to, that helps us begin to look at if there are unmet needs that can be met with the waiver, then we would proceed to look at the urgency scoring. If there are unmet needs that we can't meet in the waiver, we are not going to say that you have an urgency for the waiver, but we should refer you to the appropriate system. So you should get those connections. Same thing if you have some unmet needs and you already have existing available supports, you are engaged with and enrolled in a system, but it does not appear as though any of those services are being accessed, then we're going to make some linkages and referrals there. If there are unmet needs that can be met with the waiver, then we're going to proceed to look at the urgency determination. And this is where we are going to get some of your information as the starting point. And again, we are not judging whether or not we think you can do it or not. We are just asking you the questions about, is what is happening right now something that can continue? So how urgent is this need? Do you have things in place that can continue for some years? Do you have things in place right now, but they can't last very long? And then we're going to ask you about how long they can last. Do you have nothing in place, right? So when we are looking at the urgency determinations, those are the kinds of questions that are going to prompt us to then look at where that scoring needs to happen, right? So obviously when unmet needs are typical daily supports, the need is going to be more urgent than when it's something that maybe is something someone would like to do or would like to do more. But it's okay. Nothing bad is going to happen if those things don't get done, right? Again, we need to make sure that the unmet need can be met with the waiver and that we are considering if the person is accessing already available supports. And we are going to look at where in a typical weekly schedule do you really have a gap? Needs are there, but you don't have supports in place. And those are the kinds of questions that are going to help us figure out where do we start in our urgency determination. So Dr. Greer, you can go to the next slide and we'll talk about those urgency determinations. So the SUN is not assessing what your needs are necessarily. It is simply assessing if you have unmet needs, or I should not even use the word assessing, as Dr. Greer said, it's screening to see, do you have unmet needs? And then how urgent those needs are. It is not about how much or what type of services are needed. So sometimes there's this belief that if someone's needs seem to be really critical, then that is going to be what the case that the individual or family needs to make. They have a lot of needs or a lot of complexities, but it's really not. A small need could still have a big effect. And again, when we put together the SUN and these urgency scorings, it was also really important to all of the stakeholders that were involved that we did not create a system where only people who had really intensive medical or behavioral health needs got in to the waiver, and people whose needs maybe could be met a little bit more simply, but they were still as important and as urgent, they were not necessarily able to get in terms of urgency. The old emergency waiver system really did that, right? So in this instance, we're really looking at not how many needs you have, not how much service you need, but what are your needs? What services do you already use today? And then with that in mind, are there things you could access that you aren't? Or do you have unmet needs that would mean you really need the waiver, right? So just remember that someone could be leaving school. And maybe they're going to need some support to get a job. They're going to need services. They're not going to be able to go and get a job without help. And they cannot get everything that they need from Louisiana Rehabilitation Services. We would then ask some questions related to, well, if it took some time for the person to get a job or to get connected to services, what happens when they leave school, right? So someone who is able to stay home if mom and dad are working, and they can continue to maybe learn some job skills, and eventually get connected, or could try doing some volunteer work for a bit, but they don't have to have support all those hours that mom and dad are working. That might not be an urgent need, but someone who's going to leave school, mom and dad work, and they cannot be home with no support for all those hours, then some sort of support in the home and or to get a job is going to be important. And even if the person doesn't need a lot of help outside of all of the school days, once their parents are home, that still would be a need that would impact that person's ability to continue living and enjoying life and their time at home with their family. And so it still could be an urgent need. So that's just a simple example so that folks can understand it's not about how much you need or what type. The same scenario for a different person may result in a different screening, because it really takes into account the person, their needs for support, their other support network, and any other services they get, and then what happens if a support goes unmet. So when somebody needs services immediately within the next 90 days, that is an emergent need. It's going to be a score of 4. And those types of situations are situations in which the person is at home, and something bad's going to happen if we don't put services in place within the next 90 days, right? They're going to end up hurt. They may end up in the hospital. If they do have any medical or behavioral health needs, those are going to get worse. But they need some support on a day-to-day basis in order for their needs to be met in a way that allows them to stay living where they're living. Sometimes people have something in place for now, but it can't last more than the next year. So these are people who need services within 3 to 12 months. And so those are folks who have an urgent need or a score of 3. And right now, the way the system works, if you get a score of 3 or 4, you will get a waiver offer. We have never had to get to a point where anybody with a 3 or a 4 is waiting for a waiver offer. If we ever found ourselves in that situation, we agreed as a stakeholder group that those with a score of 4 would get their offers first, and then followed by those with a score of 3. If everything is good past the next year, but you anticipate a change in 1 to 2 years. So maybe someone is going to graduate from school, so whatever help they're getting at school is going to go away. Maybe someone is going to no longer be of an age where they can access some of those youth supports we were talking about in the Medicaid state plan, and they're now going to have some unmet needs. And that's going to happen 1 to 2 years out. Then those are critical needs. These people are not going to get a waiver offer this year, but we are going to be watching and planning for the fact that they will need one in the next 1 to 2 years. And folks who are doing okay right now, and they anticipate a change, but not until 2 to 5 years from now, those folks will get a score of 1, which is planning category. And if somebody's really good now, no real unanticipated unmet needs in the future, the need is more than 5 years away, or whatever the unmet needs are not things that can be accessed in the waiver, or we believe that there are other services available that aren't being accessed, then we don't have enough information to say there would still be a need if those services were accessed. So whether it's through the Medicaid state plan, like I was talking about, or getting back with the school system to help with something in school. So those are things, anybody in these categories would get a score of 0. So we would say these people do not have any unmet needs that can be met with the waiver in the foreseeable future. So those are the urgency scorings, and we wanted to share that with you guys so that you understood that. Right, Dr.
Thanks.
Greer?
Thanks, Dr. Keller. All right, so I'm going to turn it back over to Paul. Paul's going to walk us through how, we talked about system entry being sort of that first piece, and this is a flow chart to kind of demonstrate how the request for services in Sun process works.
Thank you, Dr.
Paul, are you
Greer.
able to unmute? Okay.
Thank you. Request for services in the Sun process. As we talked about earlier, you would go to the LGE, you would go get eligible. Either you're eligible or the individual is not eligible. If they're not eligible, and this has happened quite often, the LGE can, if someone may be looking for a job, or they may be looking for housing or some medical, if they're not eligible for OCDD at that level, the LGE will typically refer them for other service options. Go up, you see if they're eligible. One of two things, you can request services, and that would trigger you be put on the registry, or you may just say the family or individual does not want anything at this time, but they do want to just make sure that they're still eligible. They will have a statement of approval. Once you're on the request for services registry, the Sun screening will start. They'll send it out, you'll be on the registry, and the office here will be noted that, hey, such and such is eligible for a registry. That process will start. A screening will be scheduled and held, and either the individual will get an emergent need that triggers the waiver offer, or at this point in time, they may be, it's not urgent or not emergent, and the rescreening will occur according to timelines. If we move to the next slide, Sun score of 3 or 4, what happens? What comes about next? The first thing that happens is a waiver offer is mailed from our data contractor or statistical resources. Next bullet, the signed waiver offer must be mailed back to the data contractor or SRI. Just we'll say there have been a number of issues concerning where the offer has not been mailed back. Usually there is a time frame on the offer to mail back if you are interested. Most people, if they've come this far, they want and they need the waiver, the offer will come back. But in the past, we have had some issues with getting the offers back in a timely manner. We've gotten calls, they thought they had mailed it back and so forth. So please, when people get that offer, please mail it back as soon as possible. Once that comes to the data contractor back that, hey, yes, I want the offer, they will be linked to a support coordination agency in that area. So there's a linkage. We call that a linkage. They're just linked. The support coordinator submits a form. It's called a 148 to Medicaid. That just basically, it's on the initial form, it says a notification to Medicaid that this individual has applied for waiver services. The support coordinator gets with the individual and the family, and planning is begun. The early stages of planning and a completion of, it's a medical form. It's a medical level of care form that is known as the 90L. And that's critically important that the individual, the family help make sure the individual gets that medical form completed initially. After they get that, the support coordinator, again, is a critical component of your waiver throughout the beginning and continues on until they get together, complete the support plan with the individual, with the family there, and it's called a comprehensive plan of care or plan of care, and that plan is submitted to your local government entity for review. The LGE, local government, completes the medical review and submits the 140, it's called a form 142 to Medicaid for approval. That's just your Medicaid approval form. Medicaid completes a financial review and its denial or decision to certify waiver. I will tell y'all from experience up here, there are very few and far where once you've gotten this far, there's a denial of Medicaid of services at this point in time. It can happen, but does not happen very often. Once that has been done, the waiver, a decision notice is sent to the support coordination and the LGE for final waiver certification. 51NH is issued and services begin. Really, the 51NH just issues, it is the LGE, the local government, since it's a diagnosis code for the individual. And what that does, it allows support coordination and the provider, whomever the individual has chosen to provide services, it just gives them a date and a time for the provider and support coordination to begin billing. So again, a lot of this is with the data contractor getting the information back on time, support coordination completing their 148 to Medicaid, and then getting with the individual, the family, getting the plan of care completed, sending to the LGE. There's work that needs to be done. There are some time frames in here, and it varies somewhat. But as soon as the offer is sent back from the family to the data contractor, we're seeing things begin to flow a little more smoothly and getting these completions done on time, and hope to get the process even not as timely as it has been. We're working on that almost every day, and we're working with Medicaid. They have been very good with helping us do that. So basically, that is the process. Once the son, you have a score of 3 or 4, and how the process flows through, as you can see, according to the slide.
Thanks so much. And just a couple of important takeaways. Like, we thought it was important to include this information, not because you necessarily need to remember every step, but we wanted you to see the steps that happen. I have gotten feedback from family members who have been waiting for longer than it should be taking to go through these steps. So glitches may happen, but we're encouraging folks to be an active part of this process and to ask questions. If you've scored a 3 or a 4 and you've gotten that waiver offer and things are taking an extended period of time, stay in touch with your local office, with your LGE, so that you can be aware of where you are in the process. And then the second important takeaway is we are seeing a lot of moving around of folks, and we're losing you. If you move or have moved since you've last contacted or had contact with your local office, your LGE, you need to get in there and get your contact information updated. You need to get with them to do that, because in these pieces, we're having to use snail mail, and we need a physical address in order to be able to find you. All right, so let's talk.
Thank you, Dr. Greer.
Go ahead, Paul.
No, Doctor, I did just want to emphasize, if you're moving around and they may have a phone number, but they don't have an address, please let everyone know in your system, in Families Helping Families, to please update those addresses for us. That has been a challenge for us in keeping in touch and finding people on a timely manner. Thank you.
Thanks. All right, let's talk about the tiered waiver design. And again, it's really built so that we are connecting the person to the most appropriate waiver. Your youth start with Children's Choice plus any available EPSDT, as Dr. Kelly walked us through that flow chart at the beginning of the presentation. For adults, the supports waiver is the initial waiver offer that's made. If your needs cannot be met in the supports waiver, there is the residential options waiver. And if the various levels within the residential options waiver. The row cannot meet someone's needs, then the now or the new opportunities waiver is at the tip top of the tier. And as Dr. Kelly walked us through in terms of the questions that are being asked as part of the SUN, those are really questions that are consistent with our planning process and the thinking behind connecting folks to the services and supports that they most need. And so there are considerations that will be explored in terms of helping to figure out how much can the person do without support from someone else. In terms of support, what are the family, friends, supports that we consider to be more natural and that someone would want in his or her life? What types of supports are in place from individuals that the person's already connected to in the community? And how does that factor into the person's day-to-day life? Also sharing options in terms of living and the benefit, not just in terms of having relationships and connections to other people, but helping keep living expenses a little bit more manageable. So what are those types of options for the person? And then technology. Technology is around all of us. We all use it to a certain degree. So what does that look like for that person? And what are the needs related to that? As Dr. Kelly noted, folks with a score of 4 or a 3 receive a waiver offer. Our goal is for folks who receive an SOA, so you're newly eligible in our system, you would get an almost immediate screening. If you have received an SOA and you've not had your screening scheduled yet, you need to get to your local office, your LGE, so we can figure out. Again, from my side, I can see the contact attempts that our schedulers are trying to make to schedule some initial screens. And if your contact information has changed or is incomplete, that's going to complicate that and perhaps prolong it. So if you were supposed to get a screen and you have not yet gotten it, please reach out so that we can figure out what's going on. We have rescreens that are scheduled at various points in time, depending on what your score was, because that reflects how urgent your needs were in terms of the unmet needs or expected and anticipated needs, or if you had no needs at that time. But we can rescreen if your needs change at any point in time, even if it changes before you're scheduled to receive another or a rescreen. There should not be folks actively waiting for services that they need today. So if your needs have changed, again, reach out to your local office so that we can talk some more with you and see what's different and what your needs are. In terms of that flow for youth, planning is occurring. And based on all of that information that's discovered about the person's goals and visions and needs, your plan of care is going to be built. And for youth, it's going to start with Children's Choice. And if Children's Choice meets the person's needs, then that is where the person, that is where that youth begins. If for some reason that waiver does not meet the youth's needs, we can do a crisis designation. And if that's temporary and it meets the needs, then you hold with the Children's Choice. If you've got a continued need beyond that 1 year, then we would look at tiering you up into the next appropriate waiver, which the next tier would be the row, and looking at if your needs could be met in the row. And again, you tier up to the point at which your needs can be met. For adults, again, the planning happens with the person, regardless of your age. In addition to planning and discovery, the LA Plus, there's a needs-based assessment that occurs. And then your plan is built using the guided sequence. If the supports waiver meets the person's needs, then the person would hold with that. If the adult has needs beyond what can be accessed in the supports waiver, you tier up to the row, and so on and so forth. If the row cannot meet your needs, then you tier up into the now. And I'm kind of quickly going through these slides just so we can have a little bit of time for questions. If you need to request a son, your status has changed, or you haven't heard back about getting your initial screening scheduled, or if you have questions about your waiver status, please get in touch with your local office. We have a QR code up, and that'll take you to the contact information for each of the 10 LGEs throughout the state. And here is our contact information. I will say, if you have questions, it's imperative for you to get to your LGE first. Those local offices are our boots on the ground. Dr. Kelly is not going to be, she is not connected with our Sun team in central office or our Weaver team. So I always like to sort of give that exclusionary statement. So that will not get you most efficiently the information you need. I would suggest you start with the LGE. You have my email address as well as Mr. Rohr's email address on here. There's also the OCDD info, and there is the main number. If for some reason you contact the LGE and there's something that they can't help you with, you could certainly get to Paul or myself. We try not to set up the system so that everyone has to go to just one person. Our LGEs are connected with a point of contact on the Sun team. So as you're contacting them, they are also getting to us if for some reason support is needed from us by way of scheduling or follow up with either the Sun or Waiver. So I guess I'm going to stop that. That concludes the formal part of the presentation, and then I'll open it up in case folks have any questions.
We had a couple in the chat. Is the signed waiver offer the same as the decision letter that comes in the mail from Medicaid?
Paul, are you able to answer that one?
No, the Sun waiver offer, it's different. That usually comes from SRI. The decision letter from Medicaid just confirms the waiver eligibility. If I'm hearing your question correct.
Casey, I can weigh in a little bit if that helps, just from me. And what that usually is going to come after we've already approved the plan. The Medicaid approval letter.
Okay.
And folks will really need to remember that they'll need to, even if they already have Medicaid, they're going to have to be sure that they apply for the long-term care Medicaid. That's the thing that we always, make sure that people try to help people to understand. They're like, well, I don't have to apply for Medicaid. I already have Medicaid. This is a different segment of Medicaid, the long-term care Medicaid.
Thanks, Michelle. That's helpful information to have too. And yeah, Sarah, if I'm reading your question correctly, that signed waiver offer happens at the beginning, that decision letter from MEDT, that signed waiver offer should come after you score the 3 or the 4, whereas the decision letter from Medicaid, like Paul said, the plan of care has already been approved. That's with the LGE. The decision letter comes from Medicaid after that. Let's see. Karen, you had said, Paul, doesn't the family have to complete a long-term even if they already have Medicaid health? And I think Michelle, you just said that as well. Thank you. And then if someone is moving from out of state, do we work with that state relative to documents, or would that person start from scratch all over? I can't speak for what every state does, but by and large, states have their eligibility process. I can say that when we know folks are coming from other states into Louisiana, we are able to do some, groundwork if the person is alerting us ahead of time in terms of sharing information about what we need on our side in Louisiana to do that. So, you know, you could give permission for that other state to talk with the LGE, and certainly information can be shared across as long as you're consenting for that to do so. But in terms of whether that speeds it up or changes how quickly they're able to do eligibility, we wouldn't be able to say that for other states.
Amy, I saw a question in the chat pop up about, could somebody explain what long-term care Medicaid is?
Oh, thanks. I see that from Lori. I am not the person to explain what long-term Medicaid is.
I can explain a little, not completely, but just to help people understand. It's about a level of care support needed. And for the waiver, it's based on the waiver rule that a person that really qualifies for waiver qualifies for a long-term care kind of support. And so the long-term care waiver application really adds it. What it does is it approves the waiver services through Medicaid. It's for if you already have Medicaid. Really the long-term care application is just an update and a technicality that you just need to complete that part of the application in order to complete that segment for Medicaid so that you can get waiver services. Paul, does that sound about right?
That is correct. Thank you.
All right. Oh, Karen, you have your hand raised.
Yeah, I just wanted to add to that. So with the long-term care Medicaid division being separate from what I call regular Medicaid, the long-term care Medicaid division has individuals who are schooled in all those applications, not just for waivers, but also nursing homes, nursing home placements. And the reason they're in a different segment is the requirements, the income requirements are much different. And there's a lot of very special income requirements that people in the regular Medicaid analysts don't have to handle. So there's a lot more allowances for different types of income and how you get that income and whether you're a Medicare recipient as well. And all of that is kind of really complicated. So that's why we have to fill out that long-term care Medicaid application. It asks for a lot of information and it can be rather lengthy, but it's just important. And that's just one of the reasons I wanted to add to that, like why we have to go to this other group to get approved again for Medicaid, even if we already have it.
Aaron, that was an excellent point. And I'm so glad that you brought that up around the income, because your income, you can, for people who are adults and are working, their income, it can be higher and maintain their waiver services. So thank you for adding that.
Okay. Yeah, thank you, Karen. All right, let's see. I'm still scrolling. Let's see. Sharon.
Claire has a question. If you see that one, Dr.
I
Greer.
do. Thank you so much. Okay, so what should people say when they call their LGE to be sure that they get brought through this process instead of dismissed? I've had some families with newly diagnosed children with IDD who told me when they called theirs, they were told they couldn't be helped because they don't have Medicaid but private insurance. And Dr. Kelly, you had shared some information at the beginning of the presentation about TEFRA. Is this an opportunity to kind of highlight that since at least?
Well, I certainly think that that's part of it. When I see every once in a while when I do a presentation, you get a question, a comment where the answer is really, it kind of depends and I'd want more information. So I'd really be curious to know a little bit more about some of those scenarios. But I mean, in general, if someone is asking to go through entry, it doesn't matter if you have Medicaid or private insurance, and a local office should never tell you they can't help you. You should go through the entry process. If you are asking for a son screening and you have eligibility, it also does not matter if you have Medicaid or private insurance necessarily. And then there is, as you mentioned, Dr. Greer, the TEFRA option, which can mean that you may not have Medicaid today, but you're applying for it. If someone is going to an LGE because they're needing help navigating something with their professionals, and that's when the LGE says that they are not able to assist as directly, maybe that makes a little bit more sense because we don't interface with the private insurance company. If someone's telling you something, that's the only thing, Dr. Greer, that I can think of that would be a legit reason to mention Medicaid versus private insurance. So, I mean, I don't know, Dr. Greer, if you would want someone to reach out to Paul, or like if you feel like you're getting dismissed by the local office, then calling our office so we can either make sure that the leadership in that local office is aware if that person should be being responsive, right, and should be helping you happens, or if there is another system we need to help direct you to, we would know more about it. But situations like this, I'd really want to know who the local office is and what are really the circumstances, because we certainly don't want that happening. If there is a process that folks need to be connected to, or even if they need to be referred somewhere else, we want to make sure that happens. It's much odder for that to be happening with TEFRA, as you mentioned, Dr. Greer. I mean, because there's lots more ways to kind of get connected through these processes, and TEFRA eligibility also happens at the local office. So I'd want to understand a little bit more about what's going on here. I'd want to know which LGE we were talking about and be able to try to do some, take some action so we could make sure that families are not just being dismissed and whatever that may mean. Again, I'm not judging what the LGE did or didn't intend to say, but just, we certainly don't want families feeling dismissed one way or the other. That needs to be vetted so we can either get them linked to other systems if that's what needed, or make sure the LGE understands what they're asking for and can help them.
All right.
And
And
so she's
Claire,
saying it's metropolitan. It seems to happen to families who don't know how to ask for a son.
I'll tell you what, Claire, if you can reach out, if you can call that 225-342-0095 number and leave me your name and best contact number, and Paul or I will circle back and have some more conversations with you. Okay, email. Oh, email's perfect, and you can email us directly. That's great too. All right, thanks, Claire. Okay, Latanya has a question. What housing options are available via the waiver for children, adults who want to stay in their home versus residential or a group home? I'm not sure about the housing options piece for children. I'm assuming the youth would be with the family. So I don't know that I understand that question. Paul, am I reading that right?
I can't see it, Amy. Repeat the question again.
What housing options are available via the waiver for children or adults who want to stay in their homes versus residential or group home?
Well, through the waivers, permanent supportive housing is offered for individuals to get a place to live. That if as long as they, if they meet the criteria and everything, and there are openings in permanent supportive housing. What comes into question though is when the family moving in with the individual in permanent supportive housing. There are guidelines, and they're pretty strict on the amount of income someone can have. If I'm hearing the question correctly, we have people housed in permanent supportive housing that have lived by themselves, or we have the waiver has worked with people whose families may have already been in some type of housing, and so we can do that. But we do have a housing component in the waivers that allows for us to assist individuals in getting affordable housing.
Thanks, Paul.
Yeah, and I would just add to that, Dr. Greer. So, waiver services have to be provided in a community-based living situation. So that could be with your family. If you're an adult, you can have your own place. And as Paul mentioned, there is some housing supports. We don't pay for the housing is not paid for through the waiver, right? There's also host home services. So sometimes individuals can be connected to a family. It might be similar to what you think of when you think of a foster family, but you don't go through a foster process and things like that. It's just if that is an option that would work for someone. Adults can use what we call companion care, where they can have someone who lives with them and provides support or helps them during the day. But essentially you're living in a home that is either yours or your family's, whether it's something an owned home by you or your family, or you're renting an apartment or a house. So I don't know if that helps.
Thanks for the additional info, Dr. Kelly.
One more thing, I did want to emphasize too, even though support coordination, when we talk primarily, they work with Medicaid waiver funded and Medicaid funded situations. They also can be an asset for other community options that may not be under Medicaid at all. That's really part of their overall mission and job, is to seek resources. I mean, primarily within Medicaid and with waiver, but they also are able to help families navigate other systems other than just Medicaid.
Thanks, Paul. All right. I don't see any additional. Sharon noted asking folks to please complete the survey. Again, your feedback sort of helps us adjust in terms of the information we cover for future presentations. So we do appreciate folks giving some information on what you need to hear. All right, LaTanya, I see that between Dr. Kelly and Paul, those answers helped your question. I don't see any additional questions in the chat. Sharon, should I turn it back over to you now?
Just wanted to say how much we appreciate you all being here. This was a lot of information, and I may need to get you to talk with our Families Help and Family Centers statewide and kind of let us ask you some direct questions too about waiver services, so make sure that we give out the correct information to families. At some point we may get you to do that. This was very helpful, and I appreciate everyone who had questions and giving input and those things. I did drop the evaluation link in the chat box. If you guys wouldn't mind grabbing that link before you exit the webinar, that I would appreciate that, and give us some feedback on what you thought about today's presentation and any ideas for future presentations that you may have. All right. Thank you all so much.
Thank you.
Thanks so much, everyone. Have a good day.
You have a good day too.
Thank you all.
Bye.